Hey y'all, Shelly here with another tip for hospice nurses. If you have a patient with end-stage cirrhosis, they're at risk for hepatic encephalopathy due to the buildup of ammonia in their blood. Not every patient gets this, but probably in my experience about 75% of the patients will, and it usually presents as a progression. So it will start out with just a fogginess and then a general forgetfulness that will progress to confusion, mild confusion, moderate confusion, and then an increase in lethargy, and then to the point where the person is difficult to arouse and sleeping most of the time. And everyone, the progression is different. It really depends on how quickly the ammonia is building up. I've seen it progress over just a couple of days, and I've seen it be over a few weeks. So it really just depends. Now, doctors will generally treat this with lactulose, either prophylactically or as a treatment. So when done prophylactically, you would start when you admit the patient, and they will have it. Usually the doctor orders 30 cc's or 30 mLs twice a day, every morning and every night. And that will prevent the buildup of the ammonia, and the person won't have the symptoms. But if the person has the symptoms and we're using it as a treatment, then the lactulose is usually going to have to be 3 or 4 times a day. And I would tell you, in my experience, it usually takes 4 times a day. And in about 2 days, you'll start to see results. They'll start to wake up. The level of consciousness is better. They're not confused anymore. And then from there, you could go on with a prophylactic twice a day once you get it. Now, lactulose comes with its own set of problems, though. First of all, it's thick and it's sweet, and most people don't like it. So if your person is doing it prophylactically and they're still alert, they may want to mix it with some water or some juice and drink it that way. Some people do like it better that way. They say it's more palatable like that. If the person is already confused, though, this is not ideal because you may not be able to get them to drink that much fluid. So you can do it through a syringe. Got to do it very slowly between the cheek and gum. It is 30 cc's, so it's going to take 20 minutes or more sometimes to safely administer it via the syringe. Usually, like I said, if the person is confused, it takes about 2 days and you'll start to see that reverse. Now, you do need to prepare for the second side effect, which is going to be the diarrhea or the very frequent bowel movements. This is what we want. So we never give anything to counteract the bowel movements because that is what's getting rid of the ammonia. But we want to help preserve the person's dignity. So you may want to get a bedside commode. You want to make sure they're wearing pants that go up and down very easily, maybe some adult briefs if they'll do that. You want a barrier cream to protect their skin from all the moisture that's going to be occurring, lots of wipes, lots of education and support with the caregiver, and making sure the patient knows this is what we want and this is not a bad thing, this is the good thing. So I hope this tip was helpful. If you have any tips that would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.